first procedure would be I'm going to introduce myself first, and I'm going to identify my client. So I'm your resident nurse, Althea, and for today I'm going to perform the posterior thorax and lungs assessment. So before that, identify. What's your name? So I'm going to ask for habits of smoking. Do you smoke? So after smoke. So it's kind of a person procedure. You can buy the privacy po since I have to check for your I'm going to inspect for the shape and configuration of the chest wall of the patient, position of the scapulae. So I'm going to check for the symmetry, and also if there are any misalignment or presence of kyphosis and scoliosis. So far about that, and I'm going to inspect for the position and also his posture as the patient is breathing. So for that, I can So as you can see na ang shoulders atong patient is gasabay siya as the patient is breathing. Next is we're going to palpate for tenderness or any pain or sensation sa atong patient. So pag-involve siya of gloves, but since wala tayo gloves, then we're going to perform the hand hygiene na lang. So for this palpation, check na to if there are any presence of lesions and masses or any abnormalities as we are palpating the patient's So we also have to check for the temperature if naiinit ka for sa likod sa ating patient. So we're going to use our dorsal to check for the temperature. So wala abnormalities sa ating patients. Next is we're going to palpate the frontus as the patient is saying the word 99. Okay, so there is symmetry and also feel ang vibration sa frontus sa patient. Next is we're going to palpate for the chest expansion. So, ito na ito i-observe na ito from sa T9 and sa T10 sa patient. And na ito if labi an echo na pag-expand sa yung chest na ito. Next is we're going to percuss sa apices and sa scapulae sa atong client, and atong dungog ani is flatness sa apices and sa scapulae. So walay hyperresonance na nadungog as percussing, so the patient has no asthma or emphysema na iyan na feel. Okay, so we're going to percuss for the intercostal spaces, so across, downward, and then we're going to compare the sounds. Then after that is we're going to percuss for the diaphragm expulsion. So we're going to measure the distance as the diaphragm contracts. So the normal na distance for this one is 3 to 5 centimeters, or if increased sa ano is 7 to 8. So for our client is ang iyang distance is 3 centimeters. So normal. Next is we're going to auscultate for breathing sounds. So we're going to use the stethoscope. So now is we're going to check for the bronchophony. So we're going to ask the client to say the 99 word as we are auscultating. Next is we're going to check for the egophony. So we'll ask the client to say the E word. So next is the perfectuality. So I'm going to ask the client to whisper the word 1, 2, 3. Okay, so So I've done all the procedures. Now is I'm going to make referrals to the client. So as per the assessment, it's okay before. So as we grow older, so we're going to take care of themselves, remove the mga vices, remove the